Hello everyone, welcome back to my channel. Today we are going to start from the endocrine system. So in this endocrine system, I'll be telling you part wise, like it will be divided into some parts because it's a lengthy topic. So first of all, let's get started. The endocrine system consists of glands of endocrine system. Um, they include hypothalamus, pineal gland, pituitary gland, thyroid, parathyroid, thymus, adrenal, pancreas, ovaries, and testes. These glands produce different types of hormones that cause a specific response in other cells, tissues, and organs throughout the body. So we'll start with pineal gland. The pineal gland produces melatonin. It's derived from serotonin, which modulates sleep patterns in both circadian as well as in the seasonal cycles. So, in both circadian as well as in seasonal cycles, it plays a role. The next comes, it's one of the neuroendocrine secretory circumventricular organ in which there does not exist the blood-brain barrier at the capillary level. So this function most of you might not have known, like pineal gland, we just think of sleep modulating hormone gland, right? Note the point, pineal gland is also called as epiphysis. All right. So it's located over here, like you can see, between the thalamus, both of the thalamus, it's located here over here. So the next one comes is the hypothalamus. It's the master gland. So upon stimulation, it causes a release of hormones from the pituitary and cause changes in the body. It depends on the levels of the amount of secretin and inhibins released. So over here, like the external stimuli will release the neurotransmitters and will stimulate the hypothalamus. It is connected to anterior as well as posterior by different ways. So this is the anterior part and this is the posterior part. The anterior pituitary, also known as adenohypophysis, is connected to the hypothalamus through a portal system, whereas the posterior hypothalamus is connected to the nerve tracts. So each of the pituitary gland, like anterior and posterior, releases its own hormones. So we will discuss one by one. So the posterior pituitary is connected to the hypothalamus by the nerve tracts which are connected to the hypothalamic nuclei. So now the nuclei to which the to which the posterior pituitary is connected to the hypothalamus are known as paraventricular nuclei and supraoptic nuclei of hypothalamus. All right. The hormones which are released by the posterior pituitary include antidiuretic hormone, ADH abbreviated, and it is also called as vasopressin. So the one more hormone is called as oxytocin, or it is also called as hormone of love. Now, the anterior diuretic hormone, it acts on the distal convoluted tubule and collecting duct of nephrons in the kidney and can cause water reabsorption. It's the main function of this hormone. The deficiency of it can cause diabetes insipidus. Now, the diabetes mellitus and insipidus are two different topics. So I'll deal with this in the next video. All right. Excess amount of um, antidiuretic hormone can build up fluid inside because it's antidiuretic. Like it is not causing diuresis. It is not causing loss of urine. So it is building up most amount of fluid inside the body. So it can result in edema, cyanosis, cardiac overload, and pulmonary edema can also be resulted from this, and certain other secondary complications. All right, moving on further. Oxytocin, as I said, hormone of love, it causes contraction of womb during pregnancy and lactation, breastfeeding. So contraction of womb, it is the easy way for labor, right? To get the child conceived for conceive. All right. Next, according to several studies in animals, oxytocin inhibits the amount, the development of tolerance to various addictive drugs. So it is one of the pharmacological aspect of oxytocin. It induces response, like it inhibits the response, sorry, in opiates, cocaine, alcohol, and reduces the withdrawal symptoms. So I'll talk about this in the pharmacology in depth. So this is what is the posterior antidiuretic hormone and oxytocin. Next comes is the anterior pituitary gland. The anterior pituitary gland over here, you can see it releases a lot of hormones. So we will study it one by one. So the first comes is the growth hormone. It's also called as a somatotrophic hormone. The growth hormone in children, deficiency can result in short development. It's also called as pituitary dwarfism. Pituitary dwarfism. Normal intelligence will be in the children and can cause obesity. Whereas in the adults, it causes central obesity, reduced cell mass, and exercise capacity. All right, next. Now, as of now, we have seen the deficiency. Now we will move on to the excess. What if growth hormone is in excess? If it is in excess, it can cause pituitary gigantism in the children. Increase of growth velocity, as you know, proportional enlargement of skeleton and inner organs, enlargement of peripheral nerves can be possible, delayed puberty, and hypogonadism are some secondary complications. All right. Now, if the growth hormone is excess in the adults, if it is excess in the adults, what happens is it results in a certain complication known as, it's not a complication, like it's termed as acromegaly. Whereas in childhood, it is called as gigantism. So, acromegaly the reason of acromegaly include somatotropic adenoma. So it's caused because of pituitary adenoma. It's a cancer tumor in the pituitary gland. All right. The next, hyperplasia and hypertrophy of soft tissues, increase of size of hands, feet, nose, and ears, cartilaginous proliferation of larynx, coarsening of facial features, and others. So these are the main points you need to remember for your exams, as the examiner likes to ask about these features a lot. So please remember. The next hormone I'm going to talk about in this video is the prolactin. It's also called as leukotropic hormone or leukotropic. Its role in enabling mammals and birds, usually females, to produce milk. So the milk production is the main feature of this hormone. The prolactin plays an essential role in metabolism, regulation of immune system, and pancreatic development. Now, the elevated levels of prolactin can decrease the levels of sex hormones. So this is what is important and ironical, right? So estrogen in women and testosterone in males. The next feature is prolactin also stimulates proliferation of oligodendrocyte precursor cells. These cells differentiate into oligodendroglia, responsible for the formation of myelin coat on axons in the central nervous system. So this point is very hidden. Who doesn't know about this, please remember. The next one is the hypoproteinemia, prolactinemia. Hypoprolactinemia, decreased levels of prolactin, is associated with the ovary dysfunction in women It causes premature ejaculation and it can cause erectile dysfunction also in males. So this is the first part. In the next part, I'll be telling you about the follicle stimulating hormone, and the next part sequentially dealing with ovaries, testes, and pancreas, thyroid, adrenal gland, and so on. So thank you for watching my video. Please subscribe and like my channel. I'll be see you soon.